Hey there, everyone. Listen, thanks for joining me here on Wednesday, not yesterday, Tuesday, to speak with Falk Kyser about living well with chronic pain and chronic disease. As some of you may know, I was ready to go on StreamYard last night with a few minutes to go. I had messaged Falk, checking in to see if he was having troubles connecting, only to realize that it was Tuesday and that I had my evening off. So here I am Wednesday back with you, and wanted to say thank you for joining me. I'll bring Falk in just a moment. If you're here, I'm just going to open the comments. I'd love it if you would drop a note, let us know that you're here with us, where you're listening from. If there's any specific topics you want covered, questions you have, by all means, go ahead and share, and I will have Falk address those as we are going through. Hi, Joanne. So we have Joanne here from Montreal. Thanks for joining us, and thanks to everyone else who is here also. Now, I do want to share really quickly before I bring Falk in. So for those who do not know me, I'm a workplace communication expert. I do coaching and training and speaking. And I just wanted to share that we have just relaunched our website. And it hasn't officially, it's online, but I haven't officially launched it, but you can check that out here at lindsaylapaquette.com. I'm really excited to share that shortly, a little more officially. And if you have any feedback, I'd love to hear it. And I've just also, let me just stick this in here, launched a brand new 6-video e-course that is free. It's on the website, on the homepage. You can find it there. And it's to help you free yourself from workplace conflict and confrontation. So you can find that at lindsaylapaquette.com/conflict. And I don't often share my specific work on here, but I'm really excited with the relaunch. So like I said, would love any feedback you have. So moving on with tonight's topic, we have Falk Kyser here with us. So Falk is a business coach and patient advocate. As I said, we're going to be talking about living well with chronic diseases and chronic pain. Falk is a certified empowerment coach, facilitator, and master trainer. And for the last 14 years, he's helped improve the lives of over 500 individuals living with debilitating chronic health and pain conditions. He has done so by empowering patients with tools and techniques that allow them to live a normal life in a wonderful evidence-based 4 to 12-week paced learning, peer-based program. And through the program, they learn how to become their own best self-managers. So we're really going to talk about the self-management of chronic pain and chronic disease. So again, welcome to everyone who's here. I will bring Falk in with us now. Hey, Falk.
Hi there, Lindsay. Happy to be here with you.
Welcome to your very first live stream.
Yes, it is. I'm glad I have a pro guiding this.
I don't know about a pro. My kids make fun of the fact that I live stream.
They see us, right? That's already better than my playing with live streams.
They don't, and they tell me that if you ask anyone to join, it doesn't count the people who are watching. So that's the advice from the pros. But so just really quickly want to say hi to Alain from Montreal. Like I said earlier, we have Joanne here, Mary Jo also from Montreal, and Christine from Montreal also. So it looks like we have a good Montreal-based crew. Would love to hear who else is here and where you're listening from. So as we're doing that, Falk, let's start off by just, I shared a bit in your bio, but having you explain how you got into this line of work and patient advocacy that you've done for so long.
Well, in 2002, December 6th, I was going to my brother's to visit him and his new girlfriend in Toronto from Montreal. And on the train ride, I lost my vision.
Wow.
And it wasn't like totally blind. Everything just was 2 feet in front of me. When I got off the train, I was in cold sweat, and luckily his new girlfriend picked me up and brought me, and he had a friend there who had gone into medicine, wasn't a doctor, but had gone into medicine. And he said, "Falk, you have diabetes." And what happened was, I didn't fall asleep that night, and the next morning that friend of my brother's lined me up with a GP who took some blood counts on me and told me, take a taxi, go to Mount Sinai Hospital. And I was diagnosed in the emergency ward with late onset of juvenile diabetes.
Wow.
I learned to live with it and still continue my professional career running companies. And what happened was McGill University Center, they started a My Toolbox program, I think it was in 2007. And they were looking for peer trainers like myself who had chronic conditions. And so what happened was I got taught in that. I started facilitating and training in that. And I went up the levels. I went to a master trainer. And I actually used a lot of the techniques in my work because it was based on a social cognitive behavioral science based on Albert Bandura. From Stanford University. And he basically taught the concept of self-management and self-efficacy. And basically, you can't change your behavior unless you build it in small steps. And that's what self-efficacy is about. And that's what the program is about, is teaching self-management. And self-management is basically the concept that you take care of your own health, you carry out normal activities in a normal life, and you manage the emotional journey of it. And if you learn to do that through self-efficacy, and that's taking little steps, your past experiences, your modeling, the social persuasion of a peer-based group all play into that in a dramatic way. And I've really seen, and I know there are some people who taught in that program. Mary Jo is one of them, and there's a few others out there tonight, I hope. They know how powerful this is. And I've had unbelievable feedback from the 500 participants that I have done through this program, about half of them through this program. And unfortunately, it during the cost-cutting times of the last Liberal government, it wasn't funded anymore. And then I started
with all things healthcare.
Yeah, that's and the problem with this is you're on these kind of funded programs from the government or from the hospital or from foundations. You're really dependent on their money. But I've brought this into the professional realm and the private sector. It has a value added basis, and it should support itself. It saves at the Montreal MUHC. In 2007, it saved $4,000 for every patient who went through it. There were questionnaires. It was done actuarial. It had less hospital visits, less hospital stays, less visits to medical people, and a lot of other statistics. In 2011, it was up to 10,000. And when I started looking at pushing this in the private sector, I talked with actuaries, insurance actuaries, and they said it's probably worth $10,000 to $15,000 per employee for an employer. And you have to add things like generic use of medicine. Like if you go from prescribed drugs or branded drugs and you go to the generic version of them, and you as a self-manager ask your doctors and ask your pharmacists. I'll give you an example. I'm a juvenile diabetic. I suffer from cholesterol. I have to take a cholesterol medicine. It isn't something you do and help yourself with diet. So I took Crestor. Now I take the generic version of Crestor. The bottle of Crestor costs $80 for 30 pills. The generic version costs $3.50 for 30 pills. It's exactly the same medicine.
Yeah.
To give you an idea, what you can do not only for yourself, but for a company and how you save.
Mm-hmm. So I just want to jump into the comments here for a second, just to say hi to a few people. So we have Paul here from Montreal, Frank the Survivor, and Ernest here from Toronto. So again, thanks to everyone for being here. And like I said before, if you do have questions for Falk, go ahead and throw those into the chat. I'm somebody who certainly does not need to be convinced as to the value of self-management of pain, as someone who has had chronic pain since my early 20s, as someone who has managed complex health conditions, both in clients in my previous role, or assisted in managing that, and then in our own family. My husband happens to also have been diagnosed with type 1 diabetes quite late in life, although he didn't quite, he got caught a little bit sooner than yours, it sounds like, thank goodness. And then through our kids having complex medical issues, I see very closely how the mental, the emotional weight of dealing with coordination in the healthcare system that is not always ideal, and trying to navigate getting the care you need, while also struggling with, sometimes the financial implications of choosing to go private when, your hands are tied, or just like, you said, having to take a certain medication, and balancing all of that with your other obligations in life. So I wouldn't be surprised if it's considerably more than 10 to 15 grand, if you look
that's
at,
a conservative estimate.
I think it would be. Yeah.
And the problem I have, the evidence base from Stanford and McGill. I can't use that evidence. So now I'm looking for corporate companies and clients where I talk with a CFO. I bring in some psychology students from a university that can do the questionnaires and so on. And I have 2 actuaries from the insurance industry that will help the CFO actually put a value on it.
Yeah. Yeah.
Well,
I mean, to me,
sure.
the cost is very high. Yeah. And so maybe, can you walk me through a little bit? I guess let's start maybe with how you define self-management and self-efficacy, just so we're all talking the same language here.
Okay, well, I think I mentioned it before. So self-management is basically where you're accountable to take care of your own health. It means you can't be in a victim state. It means you have to take accountability of your health. And that's not always easy, because if you're dealing with somebody as a victim, and you know that as a coach, and they don't want to be helped, whatever you do, whatever program you do, it isn't going to happen. And what I've often done is said, well, you're just not ready. Come when you're ready, when you're ready to take that next step to work on it. But there's a big advantage with chronic pain and chronic diseases. When you have MS, or you have muscular dystrophy, or you have diabetes, or you have fibromyalgia, or you have enormous pain that's not 10 on a 10 scale, but 15 or 20 in loudness. You're more ready to put your personality aside, and you're more ready to actually take action. And it's in a peer group. So it's a paced learning program in a peer group where you have a facilitator or 2 who have experience. Like, I have 3 chronic conditions. So I know what it feels like.
Right.
And so you have empathy, and you're not talking in a hierarchical way like a doctor or nurse talking down to you. You're talking and being helped by somebody who's facing the same things you are. And you're in a group, and it's my job in the group to help people in that group facilitate and help psychologically persuade each other by making action plans, by changing behavior, and seeing it happen. And that pushes the majority of the group to do that.
Well, and I'm going to guess too that being in an environment where other people get your struggles, right? So when I think of my journey of parenting kids with needs, not that I necessarily went through this type of program, but finding people who had an understanding of the challenges I was experiencing. And they weren't necessarily, like if you're looking at your group, one person has MS and another person has diabetes, and the specific day-to-day challenges are maybe not exactly the same, but there's a base understanding of what it is like to have to deal with a complex ongoing condition. That in and of itself is of huge value, because that's sometimes hard to find. So I can see where it being peer-based has I'm going to guess, apologies, my alarm. My kids have tutoring. I'm really sorry. I got to text my husband because I'm not sure he knows. So 1 second. I apologize. I don't normally do this. But yeah, can you speak to that aspect a bit about that peer facilitation part?
Well, and what's brilliant about this design course, and I've really elaborated on it because I've built a lot more modules than the Stanford or the McGill course. I've put hope, resilience, the navigating the Quebec system, because I'm a patient advocate. I can teach people how to get a GP within a month, no problem.
That's awesome.
or a specialist within a week.
Wow.
If you know what to do. But what the big plus on this system is, it's not disease specific. Meaning MS,
Yeah.
diabetes, they have commonalities, meaning you have the same frustrations, you have the same anxieties, you have the same fears. And that's what this course is addressing, the things that can change you. It breaks the vicious symptom cycle. In public speaking, you often say stories are great. When you have chronic pain or chronic diseases, stories add to the problem, because you get so emotionally attached, so anxiety driven, so fear driven, and that's actually where you have power to change. You can't get rid of the disease. There aren't no silver bullets for MS or diabetes, not yet. Hopefully one day there will be. So you have to manage it. And you spend 99.99% of the time managing it on your own. You only go to the doctor's 2, 3, 4 visits a year, and hopefully you're not in the ICU or in the hospital bed very often. That's the only time you see the system. And the system in the Western world and in Montreal is very good when you have like a serious issue, like you have COVID and you need to go to the ICU. The reason the death rate is so low is because our hospitals are insanely great for medical emergencies. Where the health system is really bad is when you have to manage these things on your own.
Yeah. Well, it's all the in between. It's when it's not emergency and getting things put in place so that it doesn't become emergency has been my experience both professionally and personally. And I think that's a huge missing piece that it sounds like your program's offering. So Joanne here is saying, especially in relation to the sacrifices we make or that people who have chronic pain and chronic disease make. And it makes me think of, I attended a grief support group at one point in my life after some deaths in the family, and they spoke a lot about secondary losses. And so people from an outside view see, okay, so this person has died and you're grieving that, but actually you're also grieving, your sense of security in the world and your relationships you've lost over it, and right, there's all these other pieces, and it feels like there's a parallel to me there to chronic pain and chronic disease, right? It's like a grief process of sort of accepting, right? Like, this isn't how I thought my life would be, and yet here I am, and how do I adjust to this to sort of live my life with this condition. So what can you walk me through a little bit some of the elements that you might be doing in this group to give people an understanding of the types of things that may be helpful when managing these type of conditions?
You have that chart I gave you.
I do. So
the first one.
I'm coming. I'm really not the best on tech.
Visual way of seeing this.
Okay, so I'm going to throw up this chart. I think it'll, oops, hang on. I got to take us out.
Okay.
I don't know if you can still talk. Let's see how this goes.
You tell me.
So.
Okay. We can't do that. Okay. Well,
I did test this,
okay,
but
you put up the grid. Everybody look at it, and I want people to look at the top boxes. There are 8 boxes. I have 2 more to add. Those are the types of things we teach. Okay, it's
hang on. Okay, wait. Give me one more.
Yeah, no problem. Hey, this is new for me too.
I told you this is totally my thing. Apologies, everyone. I have not. Okay, I'm going to take your suggestion. I'm going to pull us out of the live stream for just a minute so everyone can take a peek.
Yeah.
And then we will come back. So look at the top boxes like Falk has suggested. Okay, so we will come back in here. Apologies, Falk.
It's really the chronic disease patient module, and it's not specific to any institution. And at the top, you saw that as a facilitator and coach, you have to reach and motivate all people. And And the key on being successful here is education and training self-management, which creates behavior change. You keep it going, and then you evaluate, improve, and keep it going. So it's something where you train the course, but in the intrinsic nature of the 180 different coaching modules in it, Albert Bandura was a genius. You're building buddy systems and relationships where you're helping each other and your new friends help each other navigate this all the way through life. And you can come back to it as well. And you saw underneath that a lot of different modules. Healthy eating. So there's a lot of talk about how to eat healthily. Active living and exercise. Smoking, stopping smoking. Yep. Weight loss. Stress management. Pain management. Self-management. Medication compliance. Hope. Hope's really important, and resilience. And you're building all of those, and you saw underneath that, this is good for cardiovascular diseases like diabetes, respiratory illnesses, cancer, musculoskeletal things like MS, and digestive disorders like Crohn's disease. So it's not disease specific, which makes this training really invaluable, because you don't have to do a separate training for each disease. It's all that you can lump everything on. There are even aspects about mental health to deal with here, but it's really a separate program, and you need higher trained professionals than I am. I'm not a psychologist, so it's not in my purview to deal with that. But it does show you when you have a depression or are in the blues, and it does tell you to get help, and takes away the stigma that depression is a real disease, and you have to help yourself and find help with it.
Yeah. I can see where it can be the building block, right? To either people who maybe aren't in a full depression and don't necessarily need a psychologist, or those who maybe are but aren't quite ready to go see one. It maybe becomes the stepping stone of getting to that spot where you see that maybe that's the next step. And I very much believe that, and I'm just speaking, this isn't what I do professionally, but from my own personal experience, that I can see where it's not being disease specific isn't necessarily the biggest deal, because in my view, a lot of it is learning what you need and how to create your life in a way that fosters more of what you need and less of what makes things worse, while also kind of juggling those emotions that come up as you do it. And I do want to share here, because I think Christine made a really good point, just looping back here, about how there's also a grief and acceptance component that loved ones need to go through. And I think that's across diseases.
Yeah, Christina's really right, because I mentioned as a coach, you go from victim, you get accountability, you take control, but there's a third step that's really, really important, and that's a difficult one, and that takes a little longer to learn, and that's surrendering to the uncertainty of things.
That is a hard one.
The best example is I have chronic vertigo. In fact, when I went to a neurologist, they said, no, it doesn't exist. And I said, that's a lie. If you have something more than 3 months or 4 months or 5, it's chronic. And then at the Montreal Neuro, I read a book about a clinician who talked that there are 11 million cases of chronic vertigo in the US. There's a whole community. And it's kind of interesting because it's invisible. So it gives me a ton more empathy for people with pain.
Right.
Because you look like the people look at you and go, you're kidding. That exists. You can't get rid of your vertigo. And what I'm saying by that is it's really important because you have to learn how to dance in the rain. You have to bring in all your loved ones and your friends into that dance, because the rain doesn't go away.
Right.
And that's part of the program. It's not only for patients, it's for caregivers, for family members. And what's very important is the group says, finally, I can talk about these emotional invisibility that everybody's seeing. There's a commonality there. There's an empathy. There is a realization. All of us are going through it. And here, Lindsay, 50% of the population of Canada and the US have chronic pain. And 40%,
50%.
50 from Stanford and McGill.
Wow.
And when you look at, that's incredible. And here's the other point. 40% of that 50% have more than 3 chronic pain and disease conditions. I have juvenile diabetes, I have vertigo, and I have glaucoma. The reason people have multiple diagnoses is your immune system is compromised.
Right.
And so you're more vulnerable. And you talk about non-issue. No one screams to employ. You know how wrong it is that employers make you feel bad? They don't realize that 50% of the people that they employ have this. Can you imagine being more flexible, allowing for these courses? How loyal those employees would become? And if you give flexibility, I need 56 blood tests a year for my conditions. So I can't take 3 days off. I mean, I'm self-employed now, but when I was working, I needed 6-7 days full day, because you can't plan these. The system tells you when you get an appointment, and you sort of have to come at that time. You can't move it around. So work has to move around you. And it's incredible that this is not even acknowledged. I mean, how crazy is this? They built two super hospitals that cost $2 billion for the English and $6 billion for the French, and there was not one bathroom in each hospital that was handicap accessible. So if you were in a wheelchair, you had to pee and poo with the door open.
Wow.
Okay, I mean, even in the healthcare sector.
That's wild.
Isn't that wild?
Yeah.
And people want to build loyalty in companies and engagement. I can tell you the number one thing to do is take this seriously and help your employers and employees.
Well, it's what led me to leave my public sector job, right? So last week, so we have 2 kids with ongoing heart issues, ongoing health issues. Our son has a heart issue and started having pain last week. And then our daughter has been having some ongoing issues, and our pediatrician went on a sick leave. And so we had nobody. We were in the middle of transferring sort of across services and had no one to process that. And the bumps in the system are such that, you need to see someone and no one would see, anyhow, blah, blah, blah. I ended up taking Tuesday to Friday almost off entirely, not fully, to go to 3 or 4 appointments to find, navigate the system and find someone who would see them. And I can do that because I'm also self-employed. It is part of what led me to leave eventually, was the stress of not having that flexibility. And I think I'm somebody who's pretty accountable. So if I had last week had a keynote booked, our son's heart was stable. He wasn't like on the verge of death. Then we would have managed. I would have been there for the keynote. So, and yet I couldn't get that flexibility I needed to deal with these things and maybe catch up on the weekend or the evening or whatnot. And so I fully buy in that it's a huge weight when people aren't being accommodated.
Employers are losing your self-management skills. And in today's market, self-management, the last one I did, it was in person, and someone helped me, Francine Turgeon helped me bring it, a pain group, into the digital realm, into the Zoom realm overnight. And I actually found it wasn't quite as effective, but it was more effective than I realized. But it is such an essential basis of talent that employers are leaving out. It is very upsetting when your priorities are to deal with your disease or your pain. It's a bigger priority than working.
Yeah. Well, it impacts your work. If you don't deal with that first, it impacts your work.
But you have to deal with it. You have to have time with it. You have to find the balance. And if you have a boss who isn't empathetic, exactly what happens is people leave. I mean, here's the big paradox.
Or they stay and they just check out.
Yeah, but here's
they just stay to get paid.
Here's the big paradox of COVID. Over 100,000 people with disabilities have become enfranchised in work because finally employees allow people in wheelchairs and with disabilities to work from home. We've been fighting as a patient advocate. I've been fighting for that for 10 years. It happened with COVID. Isn't that a wonderful paradox? And you know,
I'll be honest and say I was
are?
angry. I was angry when I saw it all happen. I was happy and angry at the same time because
Yeah.
I thought it has been years that I've been pushing these messages, again, not professionally, but just out of personal interest, because I think it's, you know, the right thing to do in the world and to pave the future for my kids. And I was angry to see that it took everybody being affected to see the importance and the value of it. And I'm concerned as I see the decisions about returning to work. I'm concerned that the needs of the majority are yet again starting to trump the needs of others who, do work better in different circumstances. I do want to go into the comments here. So Joanne is saying, what does that say about patient engagement? That there's a need perhaps, and that this is what she does in her volunteer work. That's a great thing to be doing. I'm curious where you volunteer, if you're willing to share. I do want to ask too of everyone listening, if you have specific questions of Falk, if you're dealing with a chronic condition, chronic pain, there's a specific situation you want to troubleshoot with him, if you feel comfortable, feel free to go ahead and ask a question in the comments, and I will get him to answer. And I guess more generally, as we await any specific questions, what are your top tips for someone dealing with chronic pain or chronic disease in terms of helping them cope? And I know that's a bit broad because kind of probably depends on what exactly they're dealing with. But do you have some general suggestions that may be helpful?
Just to go to Joanne Galt, you at the MUHC, with COVID, it's tough to physically volunteer, but I think that'll change in September and October. The MUHC has 4,800 volunteers.
Wow.
Okay, and all hospitals want volunteers, so it's not hard to look to be a volunteer outside the pandemic time because they don't want. Tips. Oh my gosh, there's so many. Those modules that I talk about, right? So what you do in this course is you learn about a lot of methods, you try them out, and then you pick the ones that work for you. And it's very, very individual. So for instance, example, with my juvenile diabetes, I got off insulin. I made a decision to get off insulin, but I did it with my healthcare providers. So I had to intensively exercise for 2 hours every second day, cardio, weights, and flexibility. And I built it up slowly. And when I didn't go for a week, I started up slowly again. A week wasn't so bad, but let's say for a month, life got in the way, I'd do it. Meditation and biofeedback were some of the tips for me too. I meditated, and I actually think biofeedback, I visualized that my cells were getting the insulin. And for whatever reason, well, I have some other reasons, I got off insulin and my pancreas started secreting insulin to 80% efficiency. When I was diagnosed with my diabetes, it was only 5%. And my endocrinologist, my diabetics doctor, said, treat it like a honeymoon, Falk. It's not going to go away, but you're lucky. Keep on doing what you're doing. So learning to make decisions, which is really important if you have cancer. Which treatment are you going to take? Okay, that's really important. Planning, sleep, learning how to using your mind and breaking up those emotions of anger, frustration, fear. There are a lot of techniques. Healthy eating. Evaluating treatments, like when you take a treatment, if you do need medicine, there are often a lot of side effects, and you have to communicate those to your doctors. You don't just take it away. You got to get to the doctor and talk to them. Physical activity, weight loss, communications, like when you're talking with your health professionals, don't accuse them of being insensitive. Use an I message. I feel you're insensitive. Hope. Okay, when I just had a couple of friends who got a bad cancer diagnosis, and the doctor isn't even continuing. They said, you won't get the treatment because you're going to die in 2 months. Are you kidding me? You can't do that.
Yeah.
And here we deal with palliative care. and it's systematic. Okay, it's practical. You a week before or 2 weeks before you die, you have somebody doing your will if you haven't done it, or your mandate, or you have people helping you navigate the system. You have people dealing with your emotional matters, your financial matters. But for crying out loud, this shouldn't happen 2 weeks before you die. It should happen when you have a serious diagnosis, right at that moment. Where's the palliative structure right at that moment? That's really important. And that's something this course trains to help you do, that, to navigate with your family, with the people that are important for you, and with doctors. You've got to become very proactive, and you've got to use the connections you have. So it's also working with your healthcare professionals. Most of them are on big pressure. It's a lot easier if, like, I remember always when I went to my doctors, I always brought the handler flowers or a thank you gift for making my appointment up. I really appreciated them because those handlers are handling the doctors and nurses' schedules. So it's not shouting and yelling at the healthcare workers. It's working at them. I remember when I came from Mount Sinai, I needed to see an endocrinologist at the Jewish General. It was over Christmas, and when I phoned, they said, "Well, we don't have an appointment till May, but I'll die before that. I have a letter of reference." She said, "Too bad, sir." And instead of getting mad, I said, "I'm going to fax you." At that time, there were still faxes. Fax you the diagnosis and the referral and the need for me to see an endocrinologist. And I said, "If you still tell me I have to wait till May, then fine. But I'd appreciate if you take a look and let a doctor see." A week later, I got the appointment. And I got into
So I'll be honest and say that, so my experiences have been similar in the system that, so we have a great pediatrician who I am desperately grateful to. As our kids were being diagnosed years ago and we had lost our pediatrician who moved, I had written a letter saying, "Hey, no one will take us. I'm desperate. We have these 2 kids with complex conditions. Everyone tells me you're great. Please, please, please take us." And he did. And I'm so grateful because he has been the piece that has kept me sane, helped coordinate it, helped me, dig through all these contradictory messages and results and make decisions. And when he went off and I was having struggles getting into the place he was about to refer us to, I got off the phone once and said to my husband, "They told me they won't accept the referral because it's not, through the right channels now that he's off." But I said to them, "Hey, this is our situation. What do you want me to do? The pediatrician's off. Not my, I have not done anything to put ourselves in this situation. This is the system. We need help. Can you please go talk to the specialist, explain the situation, and give me a call back?" And I said to him, "We'll see what they say, but I think they get a sense that I'm not giving up. Like, if they come back with a no, I'm finding another channel." But I'll be honest and say it feels very unjust to me that, I've worked in healthcare. I know the system. I'm pretty assertive, and it feels terribly unjust to me that if that weren't the case, we might just be sitting with our hands tied. And so I do see where that piece of self-management becomes the key in some situations. Sometimes you make that first phone call and you get someone who's, empathetic and willing to work with you. But when you don't, sometimes you have to keep pushing and pushing and pushing until you find that person. And so I see the value of it while also feeling like the system needs to do a lot of work on its own also.
You'll be a perfect trainer because you get it. You get it because that's the peer-based training. It's people who know how to navigate the system, and you're bringing that to them, modeling it, and you're telling them, "Well, go do it yourself." And you see the end result. It's absolutely essential. This is a great medical system for emergency care, for tertiary care, but it sucks for anything in between. And half the Canadian, it is estimated in the Western world that the largest expense, it may not happen because of COVID, before COVID, it was estimated that debt would be usurped by healthcare costs. And just imagine the value if all of us were better self-managers. Just imagine if you came to the hospital and you communicated to your therapists and your nurses that you're dealing with exact points of pain, not being general. I'm in a lot of pain. Where is it? What's happening? Do you have a log? When is it happening? Are there triggers? You know how much easier it is for a doctor or a nurse to help you if you communicate that? And if you communicate, I feel you're not listening to me, rather than you're a jerk.
Yeah.
They want you to be on the side, right?
Well, I think they're well intentioned, right? And so you're bringing me back to a recent episode in ER with our son where, we clearly communicated the pain. They concluded it was nothing. And I felt a little uneasy with the conclusion, but also thought, okay, he's checked it out. He knows what he's doing. And we went home, and sure enough, we were back in ER within 24 hours, and we were on the verge of being sent home again. And I was feeling much more uneasy, and I was getting ready that time to sort of say, like, hey, no, we're not, we're not going, you need to look into this further. When another doctor, well, it was the resident first, then the doctor came in and she pulled down my son's mask and watched his facial expressions while palpating. And then she could see that even though he was saying no, he actually was in a lot of pain. And so the whole thing made me reflect on, was I not communicating well enough? Were they not listening well enough? And I think it can be a marriage of the two, right? And so I think we both have a role to play in there, in that, as patients, we have a role of, in hindsight, I think in that first visit, I would have said, hey, listen, I understand that you feel nothing's going on, but it's been a really quick exploration, and I know my kid well, and I just, I need you to do a full differential here. And so it's a learning journey. Each step you go through it, learning, where did that break down? How did I not get what I needed that time? What do I do differently next time for a better result? And I think we have both responsibility as patient and as a healthcare professional to do that.
And you bring up that there are a lot of navigation tools. We're the only province in all the states in North America that has enshrined patient rights. There are 12 of them. Very few people know about them.
I don't know that.
One of them is to file a complaint. And
don't get me started, Falk.
But hang on. I'm flipping this. I got friends with a lot of the ombuds people at the MUHC. And I remember one remark said, well, you guys, a lot of the complaints, 50% of all the complaints go away by me just listening. By me, because I'm going through the frustration. But if somebody at the other end listens, and they said, you don't really always need an ombuds person. You need a patient advocate or a patient volunteer just to listen, because that's the biggest problem I see, especially with pain.
Makes sense to me.
People don't believe it's invisible. Everybody around you thinks you're crazy.
Yeah.
I mean, when I had chronic vertigo, they were diagnosing me for mental illnesses, for blood tests, for any crazy diseases like syphilis, gonorrhea, all the craziness, for MS. And it was a matter of exclusion. It was very frustrating, but it was really frustrating when he didn't believe me that I had chronic pain. And then the funniest thing was, there he was in the hospital. I saw him, my neurologist, and he was suffering from it. And I was very empathetic. But I went to another neurologist, and he said, of course you have it. And of course dizziness doesn't always go away.
Yeah.
But it's the understanding and the communication. And I do think, especially doctors, I know in the French system, I have a good friend right now, in the education to become a doctor in the French system, they now teach compassion, empathy, and listening.
They do in the English system too. I have asked my doctor.
Yeah, it hasn't quite entered it yet, but I think in a generation we're going to get better doctors who are more like some of the really good listening nurses.
Well, and I think, part of what I was thinking listening to you there is, through my journey, I've learned to trust my gut better, and when I'm paired with a professional. So again, to give you a contrast, when our pediatrician went off and we had to have our heart seen by another doctor, she was great. So she would say to him, is it hurting when I press? He's only 11, right? Is it hurting when you jump? Is it hurting when you run? Is it hurting when you have anxiety? And whatever he said, she trusted it 100%. So when she said to him, does it hurt with anxiety? He said no. And he knows what anxiety is. He has anxiety, and she trusted that and moved on in her differential. And so it's fascinating watching her, how patient-centered she was, and how much she really quickly was able to be like, I don't think it's this, based on what I'm getting, I think it's this. And so I've learned to trust my gut better, that when I get someone who I feel uneasy with the conclusion, because I feel like there's sometimes some bias in, they say it's not anxiety, but then that's kind of what they have in their head. And then the questionings are all sort of in one direction, and instead of like collecting all the info first and then going to a conclusion, I've learned to trust my gut and ask to be switched professionals.
You're brilliant. The decision-making model comes from the Cancer Society in the United Kingdom, and in cancer, you have to make life and death decisions as a patient.
Can't imagine.
So they say you do your rationale, you look at the pros and cons, and then you ask your gut, and you never go against your gut. If you really analytically think it's wrong, your gut, then you change the pros and cons, you change up the circumstances until your gut is aligned. And they say that's the most important thing. And guess what? It's one of the biggest tools I've used as success in business coaching too, is to trust your intuition.
It's your other area, right? Yeah.
So way to go, girl.
Yeah. Well, so is that a lot of what this program is bringing then, right? Is like that ability to sort of wade through the noise of, what everyone is telling you from these multiple professionals. If you have a chronic disease or chronic pain, that, you're getting all this different input and sort of left trying to figure out whose opinion, one person's saying it's diet, one person's saying it's meds, one's saying it's not meds, one's, to just sort of step away from that and yourself, because what I'm hearing you say about the program was it's all these different tools, and each individual tests them out and sees what works for them. And to me, that's what makes the most sense, because what works for me may not be the piece missing for you, even if we have the same condition.
Absolutely. And then there's also,
it's like self-awareness a lot, eh?
In reframing. For instance, I have vertigo. I would love to get rid of it. It interfered with my exercise and diabetes. And I just surrendered that I'm not going to find the reason why I have vertigo. But what happened was I realized my intuition said, Falk, the vertigo is a mentor. And it has made me so much more sensitive when I do these pain courses, because I know the frustration that people with pain that's invisible feel, because everybody doesn't see my vertigo. When I'm giving, I'm a public speaker. I'm a professional speaker. I have learned how to fall on stage. I actually keep on going to Toastmasters to learn how to stand.
Wow.
Okay. But the flip side of the vertigo is I can teach balance when I'm off balance. And most of us are off balance in life, whether we have chronic conditions or just a normal, regular life without them. We never are in complete balance. And I'm really lucky when I'm out of balance, the world starts spinning. So I actually have a barometer built in. So I'm seeing the positive part of it too. And that's
a neat way to look at it, eh?
Yeah. I had a wonderful private patient who had incredible allergies, and he went into anaphylactic shock, and he's a filmmaker, an animator. And when we did several sessions together, he realized that his filmmaking and his animation and creativity derived from his uncomfort in being himself. So there was a positive element into it. And we built his resilience by, he started building resilience, and we measured it, and he told me what the resilience was. I want to be with a woman instead of a boss. I want to skateboard, but you can only skateboard after the sun set down. And he didn't have any problem becoming a nocturnal creature because he could live more normally. So we can make the adjustments.
Yeah.
And also make the adjustments not to see it as an adversary all the time, but that it is part of the whole of who we are, and it can actually help us move forward creatively in life and be more empathetic. And like you just said, you reflect, and your son's really lucky about it, and you're lucky that you do that.
Well, and listening to you, I'm thinking earlier on in my journey where that was so hard, right? That resistance, I guess, of like not wanting it to be this way. And I look at it now and think I would never go back to life the way I was living it before, like at all. I think the lessons it's taught me on slowing down and listening to, and I'm not saying I practice this all perfectly, but much better than I used to. And it has brought immense beauty to my
Yeah,
life. But I also recognize that when you're in the thick of it, it's hard
it's
to
hard to do it.
yeah. And I can see where being in a group with peers sort of
Yeah, and
helps.
when you hear these stories,
Helps
and
out there.
there are great the meditation. When pain medicines went, a lot of pain medicines went out the window several years ago. John Kabat-Zinn grew with his pain management from his university. He comes to Toronto quite often, and he has a template on how to bring your awareness into the pain to make it more bearable. It doesn't get rid of it, but it doesn't take up all of your life. Just like
Right.
cancer shouldn't take up all of your life. You have to have your essence quality still happen.
Yeah.
And you've got to compartmentalize. And this program, I think the image, show the last image of the guy in the wheelchair.
Sure. Hang on one
That
sec
is
here.
my metaphor
Okay, so
for,
I gotta pull us out again.
yeah,
So one sec. Let me just move down here. So I'll throw this up and take Falk and I out for.
yeah. That's my favorite image of what self-management of chronic conditions is. I have actually seen people, not from the program alone, actually get out of their wheelchairs.
Wow.
And I have two people that I remember, and one of them a year later sent me Falk. There was a facilitator with me in the MUHC program who had progressive multiple sclerosis, and she was wheelchair, and through biofeedback she learned how to walk. And she
That's
was
wild.
modeling that, and she said, if you don't believe me, then start listening. It can happen.
That's
And
wild.
I brought that story, and that modeling is so important. Albert Bandura is so important because if other people see your behavior change and see that it's changing your world, they have a belief. They build self-efficacy to do things. And this woman who was in a wheelchair a year later sent me a picture of her kayaking on the Saguenay. She was walking, putting the kayak in the water. And when I
Wow.
met her and when I left her, she was still in a wheelchair. She said, and that picture, self-management is like water. It makes you float and rise to live a normal life. That's how
Right.
powerful this concept is and how powerful the models are. It really changes life. And the wonderful thing is your ego gets out of the way. In business, it's a lot harder to coach because personality
Yeah.
is a cult. But when
Yeah.
a person is facing a debilitating disease or a debilitating pain, they're ready. Once they get out of victimhood, they're ready for help.
Yeah.
And it's a motivation.
Yeah.
And I always
It's a
say,
journey.
why does it take a heart attack or a cancer diagnosis or those things for
Mhm.
us to set our priorities in life?
I know. I know. I mean, I'll be
Why do we
honest,
need
as I
that?
was like irritated last week with all these things that were piling up, I kept thinking, this is your kid's heart, right? Like, what are you irritated about how far behind you are on this thing that is due? It's your kid's heart, right? And I had to like stop myself and check myself to sort of like rebalance where my attention was going. And because again, like the things that are actually really important in life at the end of the day are way more my kid's heart and well-being than all the stuff that's piling up. And so it's again, like it's a journey to get there, but I think it really does put things in perspective,
And sets
in
your
terms of all the
priorities
small
right, huh?
things. Yeah.
I mean that's the wonderful thing. I don't even need actuaries. A lot of times we say, "What does this disease mean to you?" or "What does this pain mean to you?" And we ask the question before and after. And after, a lot of the people say it's a blessing,
That's
like I
neat.
did
That'd
with
be
my
neat to
vertigo.
read the evolution of how I don't mean just myself, but how one perceives it, at the moment of diagnosis or that moment where that point of no return in your life, versus once you've had a chance to sort of adjust and I guess grieve and like discover the new way you're, going to be in the world. It'd be really neat you got to put some of that stuff together.
And all that learning you and I are doing makes us better coaches, makes us more productive, sets priorities. I remember like when I went through this whole diagnosis of diabetes and I came into my business, I grew the business 13 times.
Wow.
Okay. And I used all of the lessons I learned from this self-management. And I used a lot of these things and help people prioritize and change their behavior and try to get out of their way to live more in their essence. A lot of people would say, they would eat lunch very quickly and they were having issues. And I said, well, you need to eat slower and you need to spend more money. And if you don't have time to spend the money on proper food, then get a dietitian. They have catering services. They can make you meals perfect for you.
Yeah.
You're not spending the money on that. Like that's a priority, more important than this job for you.
Yeah. Yeah. Well, it makes you really stop, right, and reflect on.
Yeah. Well, I love how you said with your son. And I remember we were going to do this about a few months earlier. And when it happened, I remember the email. I said, Lindsay, this can wait. Take care of what you have to take care of.
Yeah, that's true. I had to cancel you once because we ended up in ER.
I am totally empathetic. Okay.
And I've learned to. I'm not saying it never irritates me. It does throw me for a loop sometimes. However, I've also learned that the people who are irritated with me over those things, not the kind of people that I can, necessarily focus on working with because, fine if you're irritated with me over, something, but when it's a situation with my kid's health that is out of my control, it's just, that's where my priority is. And I'm very upfront about that. And while also, balancing being responsible about my obligations. But I think it's a lesson I learned through my journey too, was don't surround yourself with people who give you grief. Right. When stuff happens that, you just can't plan for. And so there's a lot of lessons that has brought to me. I just want to go into the comment. Oh, sorry, go ahead.
Go for it.
So I just want to come in. It's interesting how we started talking about how it's applicable for all sorts of different diseases and conditions. So Christine here is saying, and now this is a while back, multiple chemical sensitivities are similarly not well understood in the healthcare system. And I would totally agree with that. And Jim here is saying that Lyme disease can be very similar. And just, again, so interesting, how across conditions, the underlying challenges are actually so similar. And I just wanted to share.
And that's why the education of self-management has to be peer related. It has to be with people who go through it, because that's one of the problems. I remember when we were dealing with it, a lot of doctors were looking, why don't you have doctors? And I said, well, doctors and nurses are fine if they have chronic conditions because they understand. Then we're even. In a relationship with the healthcare system, you have a hierarchical communication structure. And really, when in self-management, you need an even communication structure. You can't have one person with more power. And that's really where, when you have Lyme disease or multiple sensitivities, if you deal with a doctor or a nurse or a team player, a therapist who understands that, they're going to be a lot more empathetic with you and more open to helping you with especially the mental aspects of stuff.
Yeah, agreed. So I just want to pop on. Hey, Diogène, we'll have to get you on here one of these days with me. Nice to see you. So I do want to share real quickly just that my experience working with Indigenous, with the Cree specifically in this regard, is that I don't want to say perfectly everywhere, but that more horizontal communication of sort of everyone having the same seat at the table, be it, the doctor, the specialist, the rehab professional, the parents, the grandparents, the et cetera, is very different. And it has, having had the experience to this is a few years back, but do that work, just vastly shifted my beliefs of how much, when we can get that involvement of everyone around the table, how much better outcomes we can get. So while I definitely believe in self-management and self-efficacy, I also believe I've said this before, but that we have work to do in that regard in terms of the system to get flowing better.
And the Albert Bandura theory, social cognitive theory, it's really important, your past behavior. The more you become more empathetic, the better self-manager you become, the more self-efficacy you gain. But here, it's also important to model. So you're modeling to your son. If somebody's gone through something, they're going to be more compassionate and they'll model a better behavior dealing with tough situations like Lyme disease or Christine's multiple sensitivities, right? And that's really missing a lot in the system. And when you get that, and then there's social persuasion. It's really important to have like-minded people in that same level communication structure help each other out. When you get rid of the hierarchies, you build buddies, you build more bonds, and self-management is about building those bonds. And it's not only building it with friends and buddies, it's building it with your healthcare professionals.
I can totally see where, like, on both ends it can influence, right? By developing the skills yourself to navigate it differently, you have more of a voice even in situations where it's not necessarily heard as well, which also I think creates, I think of, flipping to the ex-healthcare professional in me, all those times that I was the one, sort of hierarchically imposing my beliefs and view of the situation on my clients inadvertently. And part of learning not to do that was through the experiences of people pointing it out to me, so I think we, can learn on both ends. So I do just want to give one last chance, if anyone has any, questions here for Falk. I see we're rounded out at 7:00 here. I'm suspecting too that they can reach out to you here on LinkedIn if there's anything they, have concerns about they didn't want to discuss in the chat. Is that a fair guess?
Yeah, and I'm really easy. There is only I've got a perfect marketing name, FalkKyser.
You do.
You put me on Google, you get to my LinkedIn profile, you get to my website, you get to everything. So my name is actually just Google it and put it on LinkedIn. I'm the one and only. That's an advantage. I don't have to put HDPPPs or www. I do that too. I have URLs and all that. But also, anybody could just text me too on my cell. So that's easy. But do reach out, and I'm happy to discuss this. I would like to continue the program. I do pro bono work. I do 2 or 3 of these workshops in the public sector every year. But I'm looking a little bit more in the private sector because I do think they have value, and I really do think people like myself and you and other people with chronic illnesses should be paid. It shouldn't always be volunteer. If you're supplying a fantastic service, you and I discussed the in companies with employees, and even in the private sector. And I think we're coming at a tipping point. Yeah. I think one of the problems in Montreal is healthcare and education is supposedly always free. But I do think with the deficits that are happening,
just wait for the mass exodus post-COVID. Yeah, something's got to happen.
Yeah, and already now there are crazy things like the CAC now are saying you got to save $150 million at the MUHC. Well, that's crap, because we're spending like terrible amounts of money vaccinating, which we need to spend, but there is a limited resource on money.
We need to move to prevention and early intervention. That's just my 2 cents that I've been spouting in healthcare for 15, 20 years now, before I gave up and left.
We need to be more empowered ourselves. I think the secret here is we can create a lot of the behavioral changes and empower ourselves to help ourselves better with healthcare, and it will serve everybody better. It is a model, a complementary model to the system. And I give you an idea. Stanford in California, they had an army of 40,000 volunteers doing this, and they estimated they were saving the medical system in California $10 billion every year.
Wow.
Okay. This reducing long-term and short-term liabilities, in reducing hospital visits, making yourself more efficient, increasing presenteeism. I mean, this should be taught in high school.
So Christine here is saying, I'll just cut in because that's perfect timing. We need to teach children so they go forward knowing how to express themselves and how to take care of themselves. And I think really you're at a big core of what needs to be done here, because I do think that the more kids are empowered to, express what's going on, even when they're, told that that's incorrect, the more they'll be able to advocate for themselves. And it's something that I try to keep in mind as my kids are, feisty and sometimes saying things that I'm just, thrown aback by. I try to remember, you want them to have a voice. Like, don't shut down their voice just because you're, tired or whatever, because you want them to be able to go into, whether it's healthcare or whatever, and also listen to others, but advocate for what you need when you don't feel heard. So I think this is huge here, Christine.
Yeah, she's totally right. I actually think it should be mandatory in all educational levels.
Yeah.
In high schools, it should be mandatory in doctors and nursing going through their training and getting certified. And it should also be mandatory for patients because, like you said earlier, it's a two-way street here.
So Alain here is saying, isn't Big Pharma the elephant in the room here?
Yeah, it is the elephant.
Lots of politics that, yeah. I mean, I think I again, in my viewpoint, another important point in that I think there's a lot of politics that, that lead to decisions that are not always in the best interest of patients. And I guess yet again, why then as a patient, developing the skills to be able to navigate all that and even be able to see the politics sometimes in the system, to be able to, advocate and navigate it is absolutely huge. Yeah. All right. Well, so I guess on that we'll wrap up. Like I said, if anyone has individual questions they want to bounce off of Falk, want more information on his program, you can reach out to him here on LinkedIn. Falk Kyser. I won't type it out because it's right on the screen here. You can find it.
It's Kyser. It's not the traditional German way of Kaiser. Okay. My relatives were lazy. They combined the A and the I into a Y.
And there's a chat too through the event, so people can always drop a message in there if they can't find you. So yeah, thank you for coming out and chatting with us about such an important topic, and I hope that everyone has had a chance to take away some nuggets from this. We will be back in 2 weeks. So I yet again forgot to check June 2 + 14, 16th with Solita Roberts. And we're going to be talking about something in relation to your image at work. So she's, I believe, a fashion consultant, and we'll be talking about topics related to, how you want to show up at work in a way that, shows who you are. So you can join us back in 2 weeks. And if you want to share this with anyone, it will be on my YouTube channel starting tomorrow, Collaborative Solutions, with the little logo up here. So you can find it there. And thanks everyone for listening. We'll see you back again. Thanks, Falk.
Thank you so much, Lindsay, for having me. And thanks everybody out there for good questions and for being here.
Yeah, I'll talk to you soon. Bye.
Bye, Lindsay.